Hello everyone, let me hope my students you are doing so well. Last time we ended on lecture 3, so this is lecture 4, and I welcome you all at lecture 4. I get set without wasting much time. Actually, time is against us. And I would like to encourage every student during their free time, if they go home, let them try to read these notes by themselves. You go through notes, because I may not have time to go through each and every word, but I will be in most cases hitting on the most important words. I break them down. So today we are resuming with the community health service. And remember the other time actually before we did talk about the community, and PHC said it begins with an individual, of which an individual abides within a certain a certain community. Now here we say it's the first contact of what health service with the community, and each community health service is to be staffed with one community health agent. And these we are talking about the health agents we are talking about here. We're talking about the village health team, the VHTs, the traditional bus attendants. We talk about there's an agent. It has gone out of my mind, but there's an agent who is ever at the village level, at the sub-county level, who monitors the activities done by these VHCs and the traditional bus attendants. And the director where we shall go to the services these people do, the village teams, what they do in their communities. And we are saying service number 1 is promotion of participation. Here they promote what? Community participation. How do they do that? Here they do that by encouraging the village members, the community members, mobilizing. For instance, let me say there is immunization taking place on a certain village. These people go house by house, informing them that, hi members, the following day we are going to have what? The health workers, we are having the nurse coming to do what? Immunize our children against polio. So that the household, if the health workers come, they should not do what? Interfere them to do their activities. So they encourage them to participate in every health activity that is taking place in the community. It could be maybe there is a construction of a borehole. They encourage the community members to go and to participate, to help them in different areas. Construction of the hospital, encourage the community members. At times they do even tell them, give in the resources within your communities for the good of the construction of the hospital. And here we are saying the control of the communicable diseases. Of course, the VHTs, they provide nets to the village members. They provide nets, and in turn the nets do what? Prevent malaria, which is among the communicable diseases. Provision of maternal and child health services. They provide services. For instance, they provide let me say, there are some other food stuff that they provide to the baby and the mother, so that they all be in good health. At times they can even encourage mothers to eat on a balanced diet, so that they keep their children, their babies, healthy. Let's talk about the provision of curative services. Yes, the VHTs, if we are having minor illnesses where someone is just feeling, it's not so severe, it's not so so dangerous, the VHTs, they have first aid. They will come around and they give them some simple medicine like Panadol. Maybe someone is injured. They will come around and do the massaging with massage oil, and the person gets better rather than going to the hospital. They gather information about a certain community, what is prevailing, what is taking place in the community, health issues. They collect the data about that. They see health stations. The lowest level of health services operating directly by the Ministry of Health. The Ministry of Health, mostly located in villages and small towns. They are staffed by the health assistants. Yeah, we're talking about now the health stations where we are saying the lowest health services do operate directly by the what? The Ministry of Health. And remember, mostly these are located what? In villages and small towns, staffed by health assistants and a nurse to make sure that to provide the medication, the treatment which is needed. You can even talk about the VHTs, the among that, the traditional birth attendants, they are among those people. Health centers. We have health centers, 2 health centers, 4. Are staffed by what? Are staffed by nurses, sanitarians, laboratory technicians, health assistants, and increasingly by 1 or 2 physicians, and also health officers. These are just self-explanatory. Class, you're going to read that by yourself. Hospitals, yes, are the most specialized and better staffed health institutions. When now we come here to hospitals, for them they have almost each and every what? Expert in the field of health. They provide curative services with increasing what? Complexity. And specialization. They provide actually the curable services to cases that are so complicated. They come when they have something which is so complicated, it cannot be handled by the 2s and the 4s, cannot handle that. For them, they will come in and handle the most complicated issues. And they also supervise these other lower levels at the sub-county levels, the parish levels, those other health centers, the health centers 2, the health centers 4, they do supervise them. Now let's look at the general health policy components. The general health components include democratization and decentralization of the health service system. The development of preventive and promotive component of health care. These are self-explanatory. Talk about the democratization meaning that everyone is included within the within the health sector, and the services must be brought to people at the village levels, from the ministry up to the village levels, what we say from the top hierarchy to the bottom hierarchy. That is decentralization. That is democratization. I come again. That is democratization and decentralization. Then development of the preventive and promotive component of what health care. Have development of an equitable and acceptable standard of health services system that will reach the segments of the population within limits of resources. Here we are talking at the whatever the equitable and acceptable, fairly distributed, and should be allowed by people, not against anyone's culture. And promoting and strengthening of what? Intersectoral collaboration, where we have the ministry of health collaborating with finance, collaborating with agriculture, education, in order to provide the service for the community members. Here, another point, we talk about the promotion of attitudes and practices conducive to strengthening of national self-reliance in health development by mobilizing and maximally utilizing internal and external resources. We have assurance of accessibility of health care for segments of the population, working closely with neighboring countries, regional and international. The rest of the point, members, you read for your own during free time. Let's go to priorities of the policy. Number 1, information. We have information, education, and communication of health shall be given appropriate prominence to enhance healthy awareness. Now here, if it's information which is needed, the education and communication is supposed to be provided to each and every person without compromising, so that everyone is aware of the activity which is taking place in a particular community and how they can take responsibility, more especially responsibility of themselves. Here, emphasis shall be given to number 1, to the control of communicable diseases, epidemics, and diseases related to malnutrition and poor living condition. Here you have promote the promotion of occupational health and safety. There promotion of occupational health, where like we provide care for people those that have broken bones, that have issues with to do with the some pain in the joints. That is occupational health and safety. The development of environmental health. However much as we are bringing services to the community members, we must conserve we must conserve the nature. We are not supposed to destroy our environment simply because we are constructing a hospital and you construct it maybe in a swamp area. No. Here we shall also talk about rehabilitating the health structures, repainting, renovating again the hospital, the old beds, those ones which are not functioning, we replace them by new others that can be repaired. We repair them. Then this appropriate support shall be given to the curative and rehabilitative components of health, including mental health. Now here the policy is support shall be given to the curative and rehabilitative centers, which include mental health. Yeah, now mental health, for instance, one of the best example that we have in the country is Butavika, where we take people who are somehow mentally disturbed. So here the rest of the point, they are just self-explanatory. Yes, you read. Yeah, I can see what you can. Yeah, you read during your free time. Now let's go to the components stroke elements of PHC. Here now we say at least essential care consists of what? The 8 elements that we are going to talk about. Number 1, health education. Provision of what? Essential drugs, immunization. Treatment of common diseases and injuries. Adequate supply of safe water. Communicable disease control. Elements are just what self-explanatory class. These are other additional elements: oral health, mental health, the use of traditional medicine, patient health, HIV, AIDS, blah 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 blah. The rest read for yourself. Let's look at now this element which is called immunization. Now immunization again is the 6 major childhood diseases, namely we have tuberculosis, we have the poliomyelitis, poliomyelitis, or you can call it just polio. Diphtheria, pertussis, you can call it whooping cough, tetanus, measles, Haemophilus influenza type B infections, Hep B. In addition, the Ministry of Health has included vaccination against other target infections, and these include cancer of the cervix and other infections caused by human papillomavirus, which is abbreviated as HPV. The gastroenteritis caused by rotavirus, pneumonia caused by mainly by Streptococcus pneumonia. And this table here, you're going to go through the vaccine that we give. We have the dose to help you during your time in the field. For the table, you go through those what. This is your work. During free time, you go through that table. So let's look at maternal and child health care and family planning. Here you have maternal and child health. Here it's saying 7% of the population are mothers and children. Protecting the health of children and women of children bearing age group of health problems of great magnitude. Maternal and child health is a package of comprehensive health care services designed to meet the promotive, preventive, curative, and rehabilitative needs of pregnant women before, during, and after delivery, as well as infants and preschool children from birth to 5 years. I think now you've understood the maternal and child health. Where we say prenatal, natal, and postnatal. Before pregnancy, during pregnancy, and after pregnancy. So the main goal of that service is to provide the health services before the mother gets pregnant, during the time when the mother is pregnant, and then after the child is born. We go on by giving them the service to make sure that they're in good health. The main functions. Function number 1. Antenatal care. Medical care given to pregnant mothers before birth. Delivery care. Even after delivery, we need to give them care. Postnatal care. That is delivery when they are delivering, and post here means after delivering. Still we give them care. Child care. Then the child that has been born also needs care. Family planning. How to teach them how to produce the number of kids that are manageable. Produce the number of kids that are manageable, that they can manage. Now here the question, what is mental health? Mental health refers to the women's health during pregnancy, childbirth, and the postpartum period. That means even after childbirth, and each stage should be the positive experience, ensuring the mother and the newborn baby realize full health and well-being potential. That one I talked about it. Then let's look at what is child health. Under child health refers to health of children under 5 years and protecting and improving the health of children of fundamental importance. Let's now go to the components of child health. Here we are saying providing of the basic health all mothers and children. We talked about these things where I provide the health services to the mothers and the kids. We're talking about reducing the maternal mortality and the morbidity. Here we talk about reducing the number of the infants that are dying, the children that are dying, and in finding out the root cause, morbidity, the root cause of a disease. We try to trace, we are tracing for the root cause of a particular illness. Morbidity. When you hear that the mortality rate rate is high or low, we are talking about the number of children that are dying. We reduce parental and neonatal mortality and morbidity. Prenatal here, first of all, we are looking at protecting the mother before getting pregnant and during the pregnancy, and also finding out what causes some of these illnesses that kill our population, kill our mothers, and kill the younger children. And also we reduce the number of children that are dying. We prevent malnutrition by teaching the mothers how to feed their children. We should encourage them to feed their children on all classes of food. Prevent communicable diseases like malaria by using nets, distributing nets to the pregnant mothers and families by VHTs and traditional birth attendants. Promoting reproductive health, encouraging mothers to use family planning methods and teaching them how to use them. Family planning methods. Regulate fertility. If you are not regulating fertility, you regulate fertility. First of all, how do you regulate the fertility? Regulate it by using the family methods, so that we shall have the baby when we want, at the right time when we desire the baby. That's when now the baby comes in. We control that fertility, the fertility of our women, by using family planning methods. Ensure the birth of healthy child, and this comes by taking good care of the pregnant mothers. Advise their husbands not to quarrel with them. Advise their husbands not to beat them during time of pregnancy. Advise their parents, even to push them to hospitals during the time for checkup, so that they remain in good health and have good mind. Factors affecting maternal and child health: education level. There are so many guys, there are so many people. So you're going to talk about these days, you're going to talk about them. You have education level. At times the education level is so low, wanting. Some of them, they don't know how to read and write, so at times they end up even not taking the medicines as it's prescribed, as it's given to them by the health medics. Knowledge of one is own right. Some of them, they are not aware of their rights. Social cultural practices. Here we are talking about practices like the genital mutilation, that is in among the Sabines, which is a very bad practice, which is not good. We'll talk about the circumcision among the Gishus, which is against healthy. They share the same knife, which puts someone's health at a danger. If the other one has a disease, you share the disease with that person, which is very dangerous. The cultural taboos. Have early marriages and pregnancies, gender-based violence, women's international of patriarchal values. I come again, women's international patriarchal values, social services, all the rest members. You just go and read, build your essays from those. You outline, then you explain and give examples. As simple as that, and life goes on well. Have importance of maternal child health. And the importance, number one here, it ensures healthy pregnancy and good health care. Self-explanatory. It aids in the delivery of healthy baby by providing immunization services. Self-explanatory. guaranteeing a balanced diet, maintaining sanitation, all those. It safeguards reproductive rights and promotes a happy life, in bracket right to side if they want to terminate unwanted pregnancy. There are many, yeah. These are just self-explanatory points for today. You have to go and read. We talk about the common health problems of mother and child. Now we're talking, number one is infection. That one actually disturbs our mothers a lot. Maternal infection can cause all these. Growth retardation, our children don't grow well, can cause abortion among the pregnant mothers, can cause low birth weight, producing small babies that way below the recommended kg. Some of them will find them they're 1.5 kg, that is below the recommended weight. Infections among the children, they can also bring diarrhea to our children, respiratory tract infection, chronic infection like malaria, tuberculosis, uncontrolled fertility. Uncontrolled fertility, now we're looking at the consequences of what? Uncontrolled fertility. And we are saying number one, increase what? Prevalence of low birth weight. The number of what children that are born with low weight to increase. Anemia, abortion, malnutrition. Then let's look at the challenges in ensuring maternal and child health. And the challenges, these are challenges that people have been studying since primary up to now. So most of you are well versed with these challenges. There are a number of them here, and they're just self-explanatory. They are just outlines. You read during your free time, members. Let's look at the emergence issues in maternal and child health. Now here we are looking at the issues like what? Emergences of new viruses. Like the Zika virus, coronavirus, as a pandemic can also result in overall what? Decrease in coverage across all maternal and child health. Now here, when these outbreaks, when the pandemics now they come in, we can even forget about the recording of the maternal and child health care issues. When you have these outbreaks, our children, they might miss services like immunization, care services, since now most of the attention is given to to these viruses that are coming by the health professionals and even the population at large. Talk about the Mabaga, talk about the coronavirus, and so many. there is increase in infertility due to various reasons can potentially affect various aspects of women's quality of life, such as physical health, mental health, social health. Now here we are saying there's also increase in what? In infertility. Why? The hustles of the day. Some of the mothers, they are hustling. They are not getting even what to feed on. So at the end of the day, the body does not meet a balanced diet. And due to that, the body becomes weak. And by becoming weak, the mother automatically loses the what? The fertility, the social health, and talk about all the time. Here the mother, they are isolated, they are stressed, and at times they are even what? Beaten by their husbands. So that another adoption of sedentary lifestyle. The sedentary lifestyle, I come again, I'm saying adoption of sedentary lifestyle by the pregnant mothers or women. Here we are seeing, when mothers actually they are pregnant, there are some other cultures that they adapt. Now I don't eat this, now I'll be eating the other one. Those cultures that they adapt, that one affects the what? The health of the body, affects the general health of the woman. And now in return, now you find that now the pregnant mother starts now getting complication. The sugar levels at times increase or decrease. I talk about the blood levels also at times increase because of the styles they adapt when they are pregnant, and they live to eat other nutritious foods that would maybe have boosted their immune system and protected them and boosted even their health. Consumption of junk food, Antonio will explain. Let's go to